Hello, my name is Michał Gruz, and today, together with my colleague, we'll demonstrate the ultrasound scanning technique of the thyroid gland in dogs and cats. The authors declare no conflicts of interest. Ultrasonography is a widely available, non-invasive diagnostic imaging technique that doesn't use ionizing radiation. From our experience, the majority of patients, both dogs and cats, can be examined without sedation, as shown in this video, which is an additional advantage of this modality. With advances in technology and the availability of high-frequency linear probes, even small organs can now be assessed with high precision, making ultrasound useful in the supplementary evaluation of thyroid and parathyroid disorders. A linear transducer is essential for this examination. While a frequency of at least 10 MHz is typically sufficient, higher frequency probes are preferred for better resolution, particularly in cats where the thyroid is smaller. The ultrasound system is typically set to the highest available frequency range to maximal spatial resolution. Given the superficial location of the thyroid gland, the imaging depth usually does not exceed 2 to 3 centimeters. The focal zone should be adjusted to the depth of the thyroid gland to optimize image resolution. Time gain compensation is typically set in a vertical line, as depth-specific amplification is usually not required. Other settings may vary depending on the ultrasound system used. Here, the patient is placed in dorsal recumbency. However, the scan can also be performed with the patient in a standing position, which we'll demonstrate later in the video. The ventral cervical region is clipped, and the skin is prepared with alcohol and ultrasound gel. We begin the examination by placing the probe transversely over the trachea, just caudal to the larynx. In this view, the central portion of the image corresponds to a transverse section of the trachea with reverberation artifact and the acoustic shadow it casts. Ventrally, we can identify transverse sections of the sternohyoid muscles and sternothyroid muscles. On both sides of the trachea, the common carotid arteries are visible, lying lateral to the expected location of the thyroid gland. Placing the probe slightly laterally on either side of the neck may improve skin contact and image quality. We'll begin by evaluating the left side. The presence of the left common carotid artery can be confirmed using Doppler imaging, revealing a pulsatile color signal. From here, the probe is slowly moved caudally along the trachea until the left thyroid lobe comes into view. The thyroid lobes are typically located lateral to the trachea and medial to the common carotid arteries. However, some anatomical variations, especially in cats, might be observed. On the transverse view, the thyroid appears oval to triangular in shape. It has a fine homogeneous ecotexture and is typically iso to hyperechoic relative to adjacent muscles. A thin hyperechoic capsule can also be identified along the gland's periphery. When scanning the left lobe, the cervical esophagus is often visible just dorsally. The entire length of the thyroid lobe should be traced in the transverse plane for a more complete assessment by moving the probe cranially and caudally along the neck. After identifying the thyroid gland in transverse section, we rotate the probe 90 degrees, directing the marker cranially to obtain a longitudinal view. On the longitudinal view, the thyroid lobe takes on a spindle-shaped appearance, with the cranial pole usually being slightly wider. In this view, we sweep slightly across the thyroid area to evaluate its all volume. We repeat the same sequence for the right lobe. First transverse, and then longitudinal. During the examination, small ramps to avoid hypoechoic structures might be visualized within the thyroid parenchyma, as seen in this image, and adjacent to the cranial margin of the thyroid lobe, as demonstrated here. This likely represents the parathyroid gland. However, this finding should be interpreted with caution, as studies shown that parathyroids cannot always be reliably distinguished sonographically. In cats, we recommend performing the exam in a calm-friendly environment. We have found that many cats tolerate the procedure very well, especially when examined in a standing position. In such cases, we gently stabilize the cat's head with one hand while scanning with the other. This allows for better control of probe pressure and positioning. When working alone without technical assistance, we find it helpful to record longer scene loops during scanning. Key images can then be selected retrospectively. Aside from patient positioning, the scanning technique remains essentially the same regardless of the patient posture. Mastering the technical aspects of the examination is the first step toward confidently recognizing pathological changes. We hope this tutorial proves useful in helping you incorporate thyroid ultrasound into your clinical or research practice.